This presentation is going to be on adult asthma management methods and medicines. Asthma is a breathing disorder characterized by smooth muscle constriction, but it is also responsible for hypersecretion of mucus in the airways. Asthma is a disorder that mainly affects children, but can present in adults as well. The two types of asthma are intrinsic and extrinsic asthma. Extrinsic asthma can be triggered by outside sources, the root word of extrinsic being extrin, or outside, and intrinsic asthma is caused by antibody-antigen reactions. Symptoms of asthma can include shortness of breath, coughing, wheezing, and chest tightness. In the event of an asthma attack, it is possible for the person to experience all of those things, but not all the time. Prolonged and untreated asthma can lead to permanent remodeling of the person's airways. Asthma affects about 25.7 million people in the US and about 334 million people worldwide. It is a breathing disorder that is more common in boys in childhood, but in adulthood it flips and females are it's more common in females. Some medicines that can help treat asthma are SABAs, and SABAs stand for short-acting beta agonist, and they are mainly used in asthma patients who are experiencing an attack and need quick relief. The beta agonists act on the beta 2 receptors in the lungs, causing smooth muscle dilation. One of the most common short-acting beta agonists on the market is albuterol, but oftentimes there are some patients who are not capable of tolerating albuterol, mainly if they are tachycardic. So the alternative to albuterol is levalbuterol. It is slightly more expensive, but in a patient who cannot tolerate albuterol, it is the only alternative. In line with the short-acting beta agonist, we have long-acting beta agonists. And many asthma sufferers are on a daily regimen of this type of medicine, and it is not used for relief, but more of control of their symptoms. Long-acting beta agonists will usually be paired with other medicines. They act in a similar manner to the short-acting, but their window of effect is generally much longer lasting, and it takes longer for it to work. They are often taken in conjunction with additional long-acting medications to achieve an adequate level of control. And some of those, the most widely prescribed medicines are formoterol, salmeterol, indicatorol, and olodaterol, just to name a few. And like with the short-acting beta agonists, we have short-acting muscarinic antagonists, and there is only one type of short-acting, and that is ipratropium bromide, or as it is better known, Atrovent. The short-acting muscarinic antagonists act on the muscarinic receptors in the lungs, binding with them, preventing the binding of acetylcholine to these receptors, which can cause smooth muscle constriction or creating bronchospasm. Ipratropium is not usually used by itself for asthma control, but usually in conjunction with another short-acting medicine like albuterol. The two of them can be taken together in a medicine called Duoneb. There are also long-acting muscarinic antagonists, and like the long-acting beta agonists, this is a once or twice a day medicine used for control, not relief. It is usually used, as previously stated, with LABAs. They also act on the muscarinic receptors in the lungs, but have a significantly longer presence of effect than the short-acting. The long-acting muscarinic antagonists can include tiotropium, aclidinium, umeclidinium, and glycopyrrolate. In addition to the SABAs and LABAs and LAMAs and LABAs, another very important addition to those treatments is steroids, inhaled steroids to be specifically, or corticosteroids. They work to help reduce the inflammation that is associated with asthma, as well as working to reduce mucus production and making it less likely for a person with asthma to react to an asthma trigger. Inhaled steroids are slow to act and may require several weeks to build up enough in the body to work, but once they do, they are very beneficial. If in the event of an emergency, the person would usually be given IV steroids. With steroids, it is important to remember to rinse out your mouth after using to avoid the development of oral thrush or candidiasis, which results in patchy white spots in the mouth that can be very painful. There are many steroids on the market, but some of the more widely known ones are budesonide, fluticasone. I actually take a fluticasone allergy medication in the morning, mometasone, and beclomethasone. In line with medicines that can control asthma symptoms, we have mast cell stabilizers. They work to prevent the degranulation of mast cells, which in turn release histamine into the body, causing allergic reactions. Mast cells are a part of our body's immune system that react to foreign substances, triggering an immune reaction. As you can see in the picture here, we have a mast cell that becomes sensitized with immunoglobulin E. Then an antigen presents, causing a degranulation. The mast cell stabilizers work to prevent that degranulation. Mast cells play a part in asthma flare-ups and exacerbations, and some of the mast cell stabilizers include cromolyn sodium and nadocromil. There are also leukotriene receptor antagonists. Leukotrienes are released in the body due to many different triggers, either antigen-antibody reaction or physical stimuli like cold weather. They are powerful inflammatory agents that can trigger bronchoconstriction as well as hypersecretion of mucus in the airways. Leukotriene inhibitors act as leukotriene receptor antagonists, and they work by blocking 5-lipoxygenase activity. There are only a few inhibitors on the market. There is montelukast, that's a once-a-day treatment available for children as well as adults. Zafirlukast, that's a twice-a-day treatment, but only for patients who are over the age of 7. And Xelutin is a 4-time-a-day treatment and only for patients over the age of 12. Leukotrienes are not meant to be taken alone for treatment of asthma. They work best when paired with short-acting broncho beta agonists, or long-acting beta agonists, short-acting muscarinic antagonists, or long-acting muscarinic antagonists, as well as inhaled steroids. An asthma action plan is an incredibly important tool for any asthma sufferer. The plan should include detailed instruction for ways in which the asthma sufferer can regain some level of control over their asthma in the event of an attack. This plan should include medications they can take depending on the severity of the attack. It should also list any important numbers to call in the event of an emergency, either friends or loved ones who are familiar with the plan, or in the event of a severe emergency, 911 if needed. An asthma action plan should also include a numerical listing of the person's peak flow. This will help other people know, as well as the asthma sufferer, what level of severity their attack is at. The plan should also include environmental or other allergic factors that can trigger an asthma attack. As stated in the previous slide, a peak expiratory flow is important to know, and that is achieved through the use of a peak flow meter, and that can help the asthma sufferer with a visual of how well their asthma is being controlled. This is something that should be done every day before the patient takes any medication. They will blow into it 3 times, and at the end of the 3rd time, they will take the highest number achieved, and that is their peak flow of the day. And from that number, they will be able to calculate their green, yellow, and red zones. And in the event of an emergency, they can use it to see which zone they fall into, whether green, yellow, or red, and then act accordingly as put forth by their asthma action plan. Another treatment for severe asthma that has been used in recent years is bronchial thermoplasty. This is a treatment that is separated into 3 different sessions. 1 session for the lower right airway, 1 session for the lower left airway, and then 1 session for both the upper left and right airways. The bronchial thermoplasty procedure involves snaking a catheter through a bronchoscope and delivering radiofrequency waves to the smooth muscle in the airway, reducing the amount of it. This procedure is mainly done in people who suffer from severe cases of asthma and is only approved for those over the age of 18. Bronchial thermoplasty has been shown to reduce the need for emergency room visits, hospitalizations, and future severe asthma attacks. Another important aspect of asthma control is avoiding triggers. Asthma attacks can happen anywhere and at any time. So one of the best ways to do that is to learn your triggers and avoid them. If a person is not familiar with all of their triggers, then it is best to go prepared with emergency medication just in case. Some of the most common asthma triggers can include tobacco smoke, dust mites, outdoor air pollution, pests such as cockroaches and mice. Their droppings have shown to trigger asthma attacks. Pets, especially ones that shed like dogs or cats. Mold, cleaning and disinfectant chemicals. I've actually seen this in the hospital where some patients have a sign on the door that cleaning cannot include bleach or anything of the such, which can cause asthma triggers. And GERD, or gastroesophageal reflux disease, can also be a trigger of asthma. Thank you very much for watching this presentation. I hope you took some good information out of it and have learned a little bit more about asthma and its triggers in adults.